Hospital, accident and emergency departments across England could be facing their worst ever crisis this winter. New figures showing big increases in A&E waiting times have been described by doctors as a cause for grave concern. Our health and social care correspondent Victoria Macdonald has this report.
These are the sort of pictures that no health minister ever wants to see on their watch. Patients on trolleys and corridors, morgues so full freezer lorries had to be brought in. This was 1999 when a flu epidemic pushed an already overstretched NHS to breaking point. Since then, officials at the Department of Health have always prepared a winter plan simply because they don't want to see those patients on trolleys. But today there is a warning that the NHS is this winter, facing a crisis. And they know that because this past summer, hospitals have barely coped. There were almost weekly reports of the pressures that A&E departments were under, and that was without cold weather and flu. Described by the College of Emergency Medicine as a cause for grave concern, figures show that this September 43% more patients waited longer than 4 hours in A&E compared with the same month 2 years ago, and that trolley waits were up by 89% over the same period.
Accident and emergency is often seen as the barometer of what's going on in the wider National Health Service, and it's really worrying to know that actually A&E departments up and down England have been struggling over the summer months. And as we're on the point of what some are forecasting to be quite a severe winter, it really does beg the question how some of these hospital departments are going to cope, given the pressure that they're already facing.
A shortage of doctors, bed blockers, that's patients with nowhere to be discharged to, the GP out-of-hours service and the ever-increasing rise of patients walking through A&E doors all have been blamed for the pressures. And the government has largely accepted this, responding recently by announcing extra funding for emergency units.
We've put in £250 million for additional capacity, better service improvements over the coming months. And we've directed that to the places that have experienced the most pressure. So it's really making the money work for patients.
The extra funding, though, is a short-term measure, and it is widely expected that a report due shortly from the NHS Medical Director will recommend a radical reform of the way urgent care is delivered.
Well, I'm joined from Bristol now by Dr. Cliff Mann, President of the College of Emergency Medicine. You've been warning about this for over a year now. Is the department listening?
Yes, good evening. Well, I think the department is listening, and I think indeed most of the key stakeholders are listening. But it's a question of trying to get them all together to agree a common solution.
But you don't think they're going to be able to avoid a crisis this winter, despite all this notice?
I think you're right. I think that we're doing too little too late in terms of what this winter offers for us. And what we need to do is make sure that we cope as best we can this winter, but ensure that by this time next year we're in a much stronger position. So what is the deeper problem? Is it trying to get people back into primary care earlier? Well, the deeper problem is the fact that we have a rise in demand, and that's fine. We should plan for that. We know that the population is becoming older. We know that there are more people with complex medical conditions, and we know that they're finding it more difficult to access alternative out-of-hours providers, so they come to the emergency department. What we need to do is properly resource those departments so they can cope with that work.
And do you think people are turning up at A&E without good reason?
No, I don't. I think by and large you can only make that case if there are credible alternatives for people to access. And my understanding of it, and that of the fellows and members of my college, is that in most cases, the vast majority of cases, there are no credible alternatives for these people to have accessed. I
mean, when we talk about the worst ever, I mean, we can all remember images of patients lying in corridors, people waiting for hours on end. I mean, are you saying that's going to happen again?
I very much fear it will, and it's not me that's saying that, it's the figures from the National Audit Office and the figures from NHS England. I'm simply providing a narrative that goes with those figures.
And, I mean, without sort of apportioning blame, because it's never that simple, I mean, is there more that individual hospitals can do to avoid those sorts of situations, to stop, you know, people who are very distressed ending up on, you know, a chair in a corridor?
Well, a key problem here is that all hospitals lose money running emergency departments. The current tariff structures mean that acute trusts simply have to cross-subsidise acute care by doing more elective care. The double whammy for them, if you like, is that when we have so many increases in acute admissions, they can do far less elective work, which reduces their income, which then means that they're likely to be in financial difficulties. We need to change the whole way in which the tariffs apportioned to acute trusts are set out, so that it's possible to run an emergency department and an emergency service without making a loss.
This always becomes political at this time of year, and Labour have jumped on this as you would predict. I mean, does this have anything to do with cuts?
No, I think actually it has very little to do with cuts, and indeed an awful lot of money is being spent on this problem. You've highlighted the £250 million being spent this year by the government. We already know that over £120 million was spent last year just providing doctor locums to emergency departments. So that's £350 million being spent on a recurring basis. If we use this money more strategically to actually develop a short and medium-term solution, we wouldn't have to pour such vast quantities of money into very short-term elastoplast solutions.
Cliff Mann, thanks very much indeed.